Now, you tend to find for people with kneecap pain that single leg extension can be a bit provocative in and of itself. And you're trying to find a way in to de-threaten the patient to also get buy-in. So what can be really effective is eccentric loading. So up with 2, down with 1. The patient tends to get a lot less pain on that eccentric part of the movement. And the other beauty is if you load it up as heavy as you can, the eccentrics really drive great adaptations in the muscle in terms of the neuromotor drive. So Jack, come and jump up. Let's have a look at this. Now personally, for my own knees, this is one of my go-tos. I have a lot of pain just doing a basic single leg extension, but if I do heavy work like this, I can get through it. So Jack, let's do your happy leg first, your left leg. And we're going to come up with 2 legs and then try and lower down slowly on the left. And then yep, that's it. Beautiful. Sitting up nice and tall, just watch you not extending the back too much. And we could look at, say, 5 to 6 reps. And relax. Now we're going to do the affected leg. It's quite nice if the patient is a bit symptomatic to put some tape on to do these heavy eccentrics. So we're going to come up with 2 legs, Jack, and down on the right leg only. Great. Also a nice opportunity if you're watching your patient do this to have a look at the muscle mass. Often it can be quite a stark difference. Of course, we're monitoring for symptoms. Totally fair play for someone to work through low-level pain if they're experiencing high-level pain. We'd obviously reduce the resistance or potentially stop the exercise. But normally that's absolutely a great exercise that people can be doing through that heavy isotonic phase, which may last anywhere from 2 months to 6 to 12 months. A bit of a target might be that they get up towards half their body weight with the eccentric lowering. So Jack, great effort there. Let's have a look at the Copenhagens, and then I'm going to look at some Bulgarians and some leg pressing. Jack, let's jump back over to the Smith rack over here. So you can do a Copenhagen off a chair. In this case, we'll use the bar. Foot on the edge. If it's the ankle, I find it tends to be a little bit painful. And we're going to drop the hips and lift the hips. Jack, come on down. Let's see if we can go work through, so 8 to 10. Just cue your patient to keep everything nice and straight and aligned. Drop and lift. Now, Jack could do that all day. Beautiful. And relax. Now, a progression for that is to put the bar up higher. So an end stage progression here would look like pitching this bar up. Once again, you've got to work with the patient in front of you. This is a higher stage progression. But it could be something like, now Jack, let's pop your foot up there. Obviously, when we're higher, we're asking the adductors to work through greater range, producing more torque, driving more stimulus, and therefore adaptation. Amazing. Great work, Jack. Come on down. So we've looked at the single leg seated calf. We've looked at some Copenhagens. We've looked at some heavy eccentrics. We're just looking at a few targeted exercises for the patellofemoral joint. We're going to come over to the plyometric box here. This is something that we call patellofemoral pulsing. And full hat props here to Craig Purdom, the forefather of Australian sports physiotherapy, 30 years leading the Australian Institute of Sport. I actually asked Craig at one stage about my own kneecap pain. And Craig highlighted what I'm about to show, and then Jack will demonstrate, as a great analgesic or pain-relieving exercise for cranky kneecaps. So it's a Bulgarian split squat position. We do want a metronome for this. I'll just grab my metronome. And we can pulse at anywhere from 100 to 120 beats per minute. And you can instruct the patient to complete 3 sets to failure. So, here we go. Now, Oftentimes the patient will feel a bit of pain when they perform this. You educate the patient that low levels of pain are absolutely fine to push through. And let's pretend I've done that for often about 30 to 40 seconds, which is about standard for people to be able to get to. A patient often comes up and can perform a reassessment and feel quite a degree of analgesia.